introduce, I'm a pharmacist, and I also do some research work, a part of which deals with patients with chronic pain and their use of medications, including opioids and such. So that's how I got involved. But enough about me. We're going to introduce our next speaker. Very glad to have her here to share her expertise. This is Emma Grace. She graduated with her Master of Science in Occupational Therapy. She's currently working in mental health, serving the Kitchener-Waterloo area. She's a registered occupational therapist, and not surprisingly, her primary interest is working with chronic pain and how it impacts a person's quality of life. So welcome, Emma.
Hello, everybody. Can you hear me at the back okay? Okay, great. So my name is Emma Grace, and I am an occupational therapist. I do work within the Kitchener-Waterloo region in mental health, but as many of you may already know, mental health and physical health are very much related. They oftentimes coexist with each other. So what I find is that when somebody's physical health is affected, oftentimes their mental health is also affected. Their quality of life is affected. The meaning that they have in the day-to-day activities is affected. So this is why I have begun to have a lot of interest in this area. But also, I just want to do a quick little bit about me. Once I figure out how to work this thing. A little bit about me. So I have my own experience with pain. Probably, again, as Matt had mentioned before, you wouldn't see it because I am one of those people who is always smiling, and we tend to have that common misperception that people who are smiling aren't in pain. That's not true. So a year and a half ago, I was in a car accident, and my life changed. I had my first experience with pain then, and it continues until this day. A little bit about what had changed. My role as an occupational therapist had changed. So there are certain jobs that I probably couldn't apply for in the future because they do require things like lifting or, moving people around. The other thing that is affected was I got married last year. Well, you can imagine relationships change. You rely more on your partner or on those people around you. And so, yeah, that did affect me a little bit. Well, a lot, to be honest with you. Third of all, I always bring her up. She provides more laughs than me up here. But that's my dog. And there are things that I couldn't do that I used to be able to do that were very important to me, like walking my dog. That was a hard activity. I mean, 150 pounds, you can imagine, she pulls a lot. So, who's walking who when I'm walking along the sidewalk? I could no longer do that without my spouse beside me because I couldn't risk a squirrel being in the way and her running off and pulling me along. In addition, I was a kickboxing instructor. That changed. I used to love kickboxing, did it for 25 years, and I lost some of that. The reason why I'm telling you this is because pain impacts our quality of life. It impacts those things that are meaningful to us. And I'm hoping by the end of this presentation, you can think about some of those things that are meaningful to you. And you can look at how are they affected and how can I help them to be less affected, or how can I still do those things and modify those things. So, understanding chronic pain. I'm sure a lot of you have seen this analogy before. I want to point out two things with this analogy. Chronic pain is like a glacier. So when we think about it, first of all, I think healthcare has only scratched the surface with what we actually know about chronic pain and how we can actually help people. But in addition, I also think that's the way people see us. A lot of times people see that little tiny bump and they think, you're fine. You're fine, you look fine. You're standing up here talking to people, but there's a lot underneath. There's a lot that affects us. So, something to consider as we're going through this. What is occupational therapy? A lot of people say to me, you help people with jobs, right? I'm used to that by now. We don't just help people with jobs. We help people with things that occupy your time. And that's one thing, if anything, you can take away from this presentation. Occupational therapists look at 3 categories of care: self-care, productivity, and leisure. And we look at what in those 3 areas are you missing? What barriers and limitations are you facing within those 3 areas that may prevent you from doing the things you want to do? So when I'm talking about self-care, some of you may have had home assessments, things like, getting in and out of the shower, getting dressed, cooking, whatever that may be, depending on the person. Productivity, so things like going to work, but also volunteering, also cooking, cleaning, housework, parenting. Finally, we have leisure, the 3rd category. Leisure is not just quiet recreation or active recreation, things like walking and kickboxing, but it's also socialization, which a lot of people lose, especially when they have pain or other chronic conditions. So we look at these 3 squares, or these 3 circles, sorry, and we look at how they impact you as a person. So we focus on the occupation. That's what sets us apart. A lot of people say, how are you different from physios? We are rehab professionals, but we focus on the task, the occupation, the activity. We do not focus on the barriers first. We look at, okay, what do you want to get back into? And then from there, we look at the barriers that are preventing you. We are holistic. This is why I'm interested in this even when I work in mental health, because if somebody has chronic pain, yes, I am going to talk about it, because it is going to impact their ability to do things day to day. I can't just leave that alone, or I'm just going to focus on the depression or the anxiety. Let's just leave that for somebody else. Doesn't make a lot of sense. Finally, we believe meaningful occupations are individualized, and participating in them are important to a person's health and well-being. So whatever occupations it is that you are lacking, that you are missing, that you are finding difficult, that's what we look at. So again, what is work? I'm going to challenge you here to think a little bit outside the box. We oftentimes think of employment, but we also have to think of volunteer, parenting, cleaning, running errands, cooking. These are all things that are work, and it's time we stop putting work in that little simple category. A lot of people, when they come home from work, are still doing work. They don't have that balance. Can I work with chronic pain? This is a very big question, and it depends on the individual. I can't answer that because really, it does depend on the individual. It depends on what your barriers are, what your job entails, a lot of different things. There are strategies to help, and we are going to be very general with the strategies to help. So firstly, we're going to talk about energy conservation techniques. Then we're going to talk about workplace ergonomics. And finally, occupational balance, my favorite part. What are energy conservation techniques? Well, the Canadian Association of Occupational Therapists defined it as an appropriate balance between work and rest. Basically what it is, cut corners where you can so you don't run out of energy before the end of the day. This is really important because people oftentimes think, you run out of energy, I'm asking for help, that makes me weak, doesn't it? No. It makes me smart. It makes me very, very, very resourceful. And it makes me able to do those things that are important to me. So we're going to talk a little bit about that. And first step, observe your activities, keep a pain diary. I know everybody hates diaries. I don't know, I do at least. I hate writing things down. But you know what? It was essential for me in the beginning. It really, really was. I had to look at, when am I in the most pain? When am I in the least pain? What affects my pain? Is it morning, afternoon, or evening? Is it when I'm doing certain activities? I had to really reflect on myself. Because bottom line, that's the only way we can figure out how to actually manage it. So psychologytools.com, I don't know if anybody's been on that site. That is an awesome site. I go to it a lot as an OT. There are a ton of free resources. There's actually a whole section on pain, but there's also a lot of other resources available. This is available on there free. You can download it and you can just give yourself a diary. This is also good for physicians too, right? You're keeping an eye, you're showing that, hey, you know what, I'm looking to adjust my activities. I'm seeing what I can do, especially for me in the beginning stages of after my accident. It was figuring out for me when I had pain and actually putting that out there. Too much? Try something smaller. Write out a chart, morning, afternoon, evening. It can be very basic, because I know that all those little squares can kind of overwhelm some people. I know it overwhelms me. So if I could do 3 activities a day, I was thinking what was causing the most pain, what was causing the least pain. That was a really important step. So what's the first thing you can do? Pace yourself. And this is a hard thing to do for a lot of people. For me too. I'm going to be honest. I am a go, 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 go kind of person. And I burn out very fast. And then I think, why did I do that for the next 2 or 3 days? When you do continuous work, you're actually depleting your energy. When you take periods of breaks throughout the day, you're maintaining your energy. That is the difference. So it's actually worthwhile for you to take those breaks throughout the day. Alternate between heavier and lighter tasks. So if you are doing heavier tasks, you want to do them for less amount of time. So the other thing is quit while you're ahead. Stop before the pain hits. Biggest mistake people make is they say, I'm feeling good so I can keep going. Stop. Stop before the pain hits. Because once the pain hits, it's oftentimes too late. And that's the real difference maker. The other thing when we're talking about pacing, delegate, delegate, delegate. Give it to somebody else when possible. Make sure that you have those around you that know, workplace may be a bit harder, but you can give those tasks, the heavier tasks away. Hey, somebody doesn't like doing paperwork? Okay, I'll do a little bit of paperwork. If you don't mind lifting those boxes, whatever it may be, that's a really, really important component. Plan ahead is the next one I'm going to be talking about. Time management. Now I have to be honest with you guys, I am not good at this one. I'm really not good at this one. I don't know about anybody else. I know we got a lot of students in the audience. I'm sure you pulled a couple of all-nighters in your time. I know I did throughout my entire time at school. Probably still will. So biggest thing to do with time management is, first of all, to make a list. If the morning is your worst time, make sure to set your alarm early. Write a list down of what you need to do. Look at, okay, what can I take out? What do I have to do tomorrow morning when I get up? So me, it's feeding the dog. Okay, I have to feed the dog before I go to work. Okay, well, what can I maybe leave out? Maybe making that big slow cooker recipe that I really wanted to make. Maybe that's not such a great idea. Maybe I'll do that the night before. Or maybe I'll leave that out for today and have a microwavable meal when I get home. Or a takeout. The other thing to do is break down the task that you're doing. So break it down and look at what are things that I can do in different positions. What are things I can do sitting? What are things I can do standing? What are things that I can do well before? What are things that I have to do right before the meal, right? Finally, adjust the activity. So that would be things like, again, as I talked about, sitting versus standing when chopping, and also maybe you have a basket next to your desk if you're at work and you have a lot of items that you have to send over to a friend. Okay, I'm going to fill up the basket and then I'm going to walk over. I'm not going to just walk over every 5 minutes and give them what they need, or I'm going to make them come to me, right? The third thing that we want to remember is prioritizing. What do you have to get done versus what can wait? And this you have to really think a lot about, because a lot of the times we think, I have to get done laundry tonight. Why? Why do I have to get done laundry tonight? Maybe I can just do one load, or maybe I can hand wash some items for tomorrow for work, right? Also, when you look at lists of work, if you have a list, I know I get tons of lists. I have to do this. I have to call this person today. Maybe I can call this person tomorrow and save my energy. That maybe I can do that documentation at the end of the day. So I'm really trying to balance out what I have to do. And it's also important to look at what is most important to you to do. So I'm not talking about work, work, work. You know, I say I have to get done laundry, I have to cook, I have to do this, so I don't have time to see my friend, even though I really enjoy that, and that to me really helps me. No, my biggest thing is see your friend, leave the laundry, leave the cooking. You want to make sure that you balance that out and you look at what is most important to you. Because a lot of times we feel guilty. We feel guilty for doing that one thing we enjoy because there's so many things we have to do. And it's time we take a step back and we say, you know what? There are a lot of things that I have to do, but I don't necessarily need to get done today. Finally, organize your space. This is a big one. I don't know if anybody ever finds that they're reaching up or reaching down low constantly to grab that thing that they need the most. Put that on your desk. Put it close to you. You know, put your items out on the table in front of you. Organize it so that things are easier for you to reach. Spend a day organizing your drawers, cupboards, at work, at home, whatever it may be. You know, if you know you're always using that saucepan, don't reach down there. If you know you're always using that detergent, don't reach high up. Put it at even. Put it at level, right? Put it right in front of you. Similarly, if you're at work, you're always reaching for that stapler. Oh, I have to get up again. You know, put it close to you. I'm sure people won't mind if you use the stapler for 20 minutes. Put it close to you. Don't be straining your body when you're doing that. The final thing is use the proper tools. Would I use a blunt knife, a butter knife to cut a watermelon? No, that would not be smart. Similarly, I'm going to be using the right tools for the job. So make sure you have, let's say, that pair of scissors so you're not having to rip it open. You know, I know sometimes when we get boxes, sometimes people just pull them open and they don't actually cut them open first. Especially at work. I know where I used to work, I was always cutting boxes open. I was always just pulling it. No, I'm fine, I don't need the scissors. I don't need the knife. Well, you know what? Maybe I do. Maybe that'll make my job a little easier. Maybe I don't have to yank as hard. Maybe I won't get injured. Huh, that was fun. A little different. Probably tried doing that when I added in a couple of the HVACs. You can see I really know what I'm doing. Workspace ergonomics. What are ergonomics? The laws of work. So when I'm looking at workspace, when I am looking at a person's space at work or even at home, I am considering three components. I'm considering the person, the environment, and the occupation. This is 101 occupational therapy here I'm teaching you guys. So what I'm considering with the person, what limitations and barriers do you have? What strengths do you have? What things help you? What things may be a bit harder for you? I consider the environment. When I'm talking about the environment, I'm talking about your physical environment, but I'm also talking about your social environment too. We're talking a bit about, you know, what if coworkers don't accept, or, you know, I'm looking at is your environment receptive to you, or is that a barrier? It might very well be a barrier. Are your employers receptive to you? Or is that a barrier? So I'm looking at the whole environment. Finally, I'm looking at the occupation. I'm looking at the tasks you have to do. So that would be, for instance, the cashier who has to stand 7 hours a day, potentially, right? So I'm looking at what actual tasks you have to do. Is it going to be repetitive motion? What is it going to be that you're doing? And we look to modify that. What can exacerbate pain? Number one, as I was talking about before, the continuous or repetitive motion can exacerbate pain. So that would be continuously, as I said, that grocery clerk, right? Who's just passing things along and putting it in the bag. That can cause pain. Second thing, poor body mechanics. Who's ever picked up a box wrong? Right? I know I have. I always get told, bend your knees. Don't use your back. But I always end up doing it anyway, right? And that is what can hurt us. Finally, fatigue. Fatigue is something that happens when we're doing something continuously. So again, if we're standing all day at our job, yeah, we're gonna get fatigue. We're gonna get a lot of it. Comfortable seating. I already see a few people sitting wrong now. So what is sitting right? So, elbows at a 90-degree angle, especially when we are typing. 75 to 90 degrees. You know, you don't have to keep it directly 90, but you want to make sure that it's not that your keyboard isn't up here or your keyboard isn't down here. Okay? Your shoulders have to be relaxed. This is a tough one, right? You can kind of roll them back and sit them down a bit. Your spine has to be straight. This means that you don't slouch in your chair. A lot of us are prone to do. I've had to improve in the past year over that. Or you're kind of scooching forward in the chair and you're not using the back properly. Eye level. So I don't know if you've ever seen, they're kind of cool, right? The kind of devices that stick outside of the monitor that you can kind of keep a piece of paper there so that you can keep your eyes at level. And that can be really, really helpful rather than looking down and up, right? Which can cause, over time, strain. Feet flat on the floor, and if they are not, you have to have a rest underneath you, right? Something that can be easily gotten. You could get books. You could get anything that you have, really. Firm surfaces, too. So, again, big, comfy couches, we love them, but they can be so hard to get out of when we're experiencing pain. So we do have to be a bit careful with that. The other thing, take breaks. It is not recommended that we sit for more than an hour. That's why we make these sessions only half hour with a 15-minute break. Hopefully you all got up. Because when we sit for an extended period of time, our body's not used to it, right? We're going to experience pain. Standing and strain. Keep everything straight. So when you are standing, a lot of jobs do require that we stand a lot, right? Constantly standing, talking to our coworkers, and maybe we're in doing a certain activity and we're having to stand, or we're, as I said, a grocery clerk at a line, and maybe we want to look at modifying that, say, can I sit down and do my job still? What options are available? But everything is supposed to be straight when we do stand, from our earlobes to the tops of our ankles, except for our back. Of course, we do have a natural curve in our back, in our lumbar spine, so we should be able to stand up straight against the wall, have our shoulders touch, our butt touch, and our head touch. That should be a proper straight position. Heels versus balls of the feet. You have to sit on the balls of your feet a bit more, but if you're standing for a long period of time, rotate back, rock back between your heels and the balls of your feet a bit. Another cool tip that I found out, I don't know, so you know when you're at the kitchen cabinet and you're washing dishes, open up that bottom drawer and put that foot on that bottom cabinet if it's sturdy enough. The whole idea is you're actually straightening your spine. Great little technique. Try it. Let me know how it goes.
You forgot that your chin.
Pardon?
I have problem with that second one.
The second one, tucking your chin. Ah, yeah, that one.
Terrible problem with that.
Yeah. You know, a lot of us, we overextend if we're trying to keep that straight posture, or we under, right? And so we've got to try to tuck in our chin a little bit. That keeps our spine straight, keeps everything together. Also, the other thing, use the tools around you. And again, that's a really, really important thing, right? So again, that kitchen cabinet. Again, using things that are around you to try to keep things straight. You know, if you have a place to sit where you can still do your activity, do it while sitting. You know, chopping vegetables is a big one. And the reason why I go back to that is because I now only chop vegetables sitting. Because I know I'm going to have to stand and cook at the stove, right? Because I'm going to be standing for the whole time. So when I'm chopping, I sit and I chop. And I actually enjoy it now. Weird. Lifting objects. Only lift when you need to. Slide when you can. In addition, when you are lifting, turn your whole body. Don't twist it. Don't do this. That can just exacerbate and cause more injury. The other thing, keep things close to your body. So a little experiment. Try it at home. Holding a coffee cup out this long. See how long you last. Hold it close to your body. See how long you last. Last a lot more with it close to your body than at far away. Avoid lifting too much. If you have to take 2 trips, 3 trips, take them. Is anybody a camel when it comes to taking those grocery bags in? I used to be so bad. I used to be, seriously, like 6 bags on either side. Really, really, I can do this. I'm a kickboxer, I got this. Wasn't a bright idea. So now I learned, okay, if I'm gonna have bag, maybe I'll have one bag on both sides, because that even one bag on both sides is good, you know, rather than being tilted one way. And make sure things are light, so don't try to bring down all the laundry at once, don't try to carry all that item. If you don't carry 3 boxes across that workstation, do what you can. Biggest thing to take away from this, each ergonomic assessment is different. So if you are at a workplace and you have disclosed or it was a workplace injury, ask for an ergonomic assessment, see what's available. But I mean, you can also make small tweaks yourself, which can be really, really, really helpful. And even as I said, if you take one thing away from the ergonomic assessments, that's great. Try it and see how it works, and try something new, see how it works. Occupational balance. My final thing, my favorite part of this presentation. And the reason why it's my favorite part is because probably nobody's got occupational balance in their life. Doesn't matter, especially students. Students are probably the worst at occupational balance. That school, that productivity, that's taken over your life sometimes, right? You lose track of your self-care. Maybe you don't shower for a few days, you lose track, maybe a week, 2 at a time, whatever it may be. But also, you also lose track of your leisure. Oh, I can't go out with you, I can't do anything tonight, I can't do this tonight, I have to work, right? Studies have demonstrated that chronic pain is actually associated with the worst quality of life when compared to other chronic conditions. It's a pretty big fact, right? So what is quality of life? It's balance between those 3 things. 33% for each of those areas. So those people that are working and have 8 hours a day that they're working, and then on top of that they're going home and they're picking up the kids from school. And then after that they are cooking. Then after that they're doing laundry. And their favorite TV show, no, I don't have time for that. I gotta do more work for the next day. They've just put productivity in the whole bubble of quality of life, right? And when we lose track of that balance, we do lose our quality of life. It's actually really interesting because when we look at people with chronic pain, I think sometimes we're the worst at trying to always be productive because we feel that we have to compensate for something. You know, this feeling of, hey, you know what, I can do it. I can do this, I can do that. No, I'll get it all done because, you know, I have pain and it's a bit slower. No, I'm going to keep on going till the end of the night, right? Even though laundry may take me 5 hours, I'm not going to go out, I'm going to just do laundry. Or even though work may take me 12 hours, I'm not going to leave work. So what I really want you to take away today is to look at that and say, you know what, am I getting my balance? And put down that piece of paper for work or put down that laundry and instead say, you know what, I'm going to put in some leisure. I'm going to go out and I'm not going to feel guilty about it. I'm not going to feel guilty about it. Because really, you know what, you shouldn't. Because they've shown that quality of life has to have those 3 circles. Maybe something you want to teach somebody, some of your loved ones, is that those 3 circles, put up that Venn diagram and say, hey, look, I need to have a little bit of this too, you know? And so it really take a moment to look at how much is in each circle. We did this first year occupational therapy, and like all of us were productivity, right? And in school, it was all in, wow. And they actually encouraged us in school, like, go out, do things. And so now I encourage myself, with somebody who experiences pain, I force myself to go out and not do the productive if it means losing some of my leisure and some of the things, because I'm going to burn out faster if I don't, right? Life is like a cell phone battery. Seems relevant. 50% is our self-care. 50% is our surplus. When we have hit that 50% for the day, what happens? We're exhausted. We really, really are exhausted. Does anybody find that they sometimes, you know, get home from a long day of work and you snap at somebody you love because you're just so, and you sit here and you go, this isn't me. This isn't me, right? It's not my personality. Well, you're digging into that self-care. And so somebody comes to you, oh, I've had such a rough day. I need to talk to you. I need to vent. You need to look at, where are you at? Are you at the place where you can vent or you can hear somebody vent? Or do you need to say, you know what, can we talk about this tomorrow night? Because right now, I'm physically and mentally exhausted. And I just need to take some time for myself. If that means going for a bath or listening to music or going for a walk, whatever it is, right? So whenever you end a day, look at that cell phone battery and say, where am I at? Where am I at? How much have I depleted? Have I done too much? Or am I okay right now to take on a bit more? Really, really important component. Something else that I've had to learn. So, thank you everybody for your time, and I guess I'll take some questions. I'll let you do that because I have no idea. This is all new to me.
The reason I put up my hand in the middle of while you were talking, I have killed myself for working all my life. I'm a perfectionist. I have to do everything like, take on more and more and more. And now I say to my husband sometimes, and he has no involvement with anything other than his job, that's all he does. I say I need to go play cards with my girlfriends because I know I'm in pain and I can't be home working 24/7. And he has a problem with it because he says, oh, you are saying you're hurting, but you want to go out. And I say, yeah, because I need to get out of here. I need to have some time when I'm not working. I'm just doing something that I enjoy, playing cards with my girlfriend. And he doesn't understand at times why I would want to, even though he never does much with it. He comes and he flops. So I say, well, I'm at home all day long alone. Why can't I go out in the evening with my girlfriends to be with some people, like I work from home, so I can't be with the four walls all day long.
Yeah.
And he has hard time at times understanding why.
I don't think you're alone. I see a few nods in the audience of people who get that. And I think the first thing is knowing that you're not alone with that. I think a lot of times people around us don't realize how leisure is important and is necessary.
Yeah.
Sometimes I say, sometimes my husband isn't quite understanding about it. I've made him.
No, but he's a younger person too. The older generation, my generation from India, they don't understand women wanting to go out and having a life of their own or whatever. I travel alone all the time because he won't go anywhere. And I say, well, that's your choice. I'm not going to stop because you don't want to go places.
And what I'm hearing is you're advocating for yourself and you're taking this kind of assertiveness and saying, you know what, I need to do what's important for me. And that's what you have to do, right? You have to, and sometimes they say doctor's orders, Just because, it's important to associate it with a part of our wellness, right? And wellness is not just productive. And there is a lot of studies have talked about that, and they've predominated women in the home because in the history that has been something, and they've talked about how home life isn't seen as work, right?
Yeah.
And
he doesn't. He thinks I just lays around on my king size bed all day long.
How did the clothes get clean? Yeah.
Everything falls on my shoulders, and he doesn't understand. And then keeps maintaining that, I just want to go and play cards and have fun and travel. And it's not that. I've raised 3 kids single-handedly. I've taken care of his business all my life and personal and everything else in between. And I don't feel guilty. I have paid my dues, and this is what I say to him. I'm sorry, but this is the way it's going to be.
And I think that's good. I think that's assertiveness, right? It's taking control and saying, you know what, this is what I need to do for me. And that's something if you can take away from this is to make a list. If you have to kind of clarify to yourself, take a list of your self-care, your productivity, your leisure. Look at what fits in what category and look at how much you do, right? Because that's what happens when we start noticing, oh my gosh, I've done a lot today, done a lot today. So that's really important, make a list, show yourself, and have that assertiveness and say, you know what, I deserve this because this is important for my wellness, because it is. Yeah, it's a great point. Thank you for sharing. Yeah?
How can people gain access to
As far as the pharmacy, I would say for people supported, it depends on the condition, and it depends on where they're coming to us from, right? Like for instance, for me, I was in a car accident, I could request from insurance to have an occupational therapist, right? And they would come and assess me. CCAC, Community Care Access Center, is another service that's available. People can refer themselves into that. And they can ask for an occupational therapist to do potentially a home assessment or other things that are available. Now, they are limited with their sessions. However, you know, if you say, hey, listen, I've only got 3 sessions, I really want to work on this one thing, potentially they can help with that as far as, you know, okay, I really need to get back independent. I need to really learn how to pace here. And so that's another area. If the mental is intertwined with the physical, you can have a referral to CMHA, and some of our programs now do have occupational therapists. Mine was one of the first in our region that came about 2.5, 3 years ago. So you know, there are availabilities. But yeah, I would say it depends on the person and the circumstance. However, I always say talk to your healthcare team, your physician, to get a referral to figure out what options are best for you, because it is very individualized. But that's a great question. Thank you.
Are there other questions for Emma? Great. Thank you very much, Emma, for a very informative session. I'm making lots of mental notes myself. So thank you all for attending, and we'll look forward to seeing you at the next session. And if you parked at the back in the lot off of Joseph Street, on your way out, you can just press a button and tell them that you're with the chronic pain workshop, and they will open the gate for you if it's not already open. Okay? And if you have any other questions about parking or anything else, just feel free to come and talk to one of us. Thank you, and have a good trip home.
They might be able to spell you.